Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about diabetes mellitus' dangerous complication, diabetic ketoacidosis. A dangerous complication of diabetes mellitus is diabetic ketoacidosis. Although it is more common in those with type 1 diabetes, this complication can nonetheless affect those with type 2 diabetes. When blood sugar levels rise significantly and ketone levels increase, diabetic ketoacidosis (DKA) occurs. Insufficient amounts of insulin in the body to convert glucose into energy are the cause of diabetic ketoacidosis. The accumulation of glucose in the blood starts from this point. Lack of insulin causes the body to burn fat for energy, which causes a buildup of ketones. It therefore results in diabetic ketoacidosis. The body produces ketones, which are acidic waste products, when it breaks down fat for energy. How to recognize the symptoms of diabetic ketoacidosis? Diabetes ketoacidosis complications must be addressed right once, especially if any symptoms or signs manifest. The following are a few diabetic ketoacidosis signs and symptoms that might emerge suddenly. Often urinating, easily dehydrated, elevated blood sugar, nausea or vomiting, high urine ketones, abdomen ache, confusion, sour fruity breath, a red face, fatigue, rapid respiration, dry skin and mouth. Delaying treatment for diabetic ketoacidosis increases the risk of death and coma. Ketones in the urine should be periodically checked for diabetic ketoacidosis, especially in persons with type 1 diabetes whose blood sugar levels are higher than 250 mg per deciliter. If ketone levels exceed this threshold or even steadily rise to 300 mg per deciliter, you should visit a doctor right once. Particularly, if you are experiencing signs of diabetic ketoacidosis in addition to your disease. The following are some hazards and problems that could result from diabetic ketoacidosis. Low amounts of blood sugar hypoglycemia. Low amounts of potassium hyperkalemia. The brain swelling, cerebral edema. Why does diabetic ketoacidosis occur? Insulin aids in the breakdown of sugar levels since sugar is the primary energy source for the synthesis of muscle and other bodily components. The body will urge the release of hormones to break down fat as a replacement for the energy source that produces ketones if insulin levels are insufficient. Ketones that develop in the blood in excess will undoubtedly have an impact on urine production. The following are some of the most typical causes of diabetic ketoacidosis. Respiratory tract infections and urinary tract infection, forgetting to administer insulin or administering too little insulin, being physically or emotionally injured, suffering from a heart attack or stroke, pregnant, suffering from pancreatitis, abuse of drugs, particularly cocaine or alcohol, using drugs like corticosteroids and diuretics. Diabetic ketoacidosis treatment. By maintaining normal blood sugar and insulin levels, diabetic ketoacidosis can be treated. Additionally, the possibility of infection raises the danger of diabetic ketoacidosis (DKA). Consequently, the doctor might recommend antibiotics to treat the illness. A number of supportive tests, including blood tests, urine tests, chest X-rays, and electrocardiograms (ECG) examinations, are required to identify the most appropriate treatment approach for persons with diabetic ketoacidosis. Patients with diabetic ketoacidosis typically get one of the following forms of care. Treatment of dehydration using intravenous fluids. Using an infusion to provide insulin to reduce blood sugar levels. Supplying electrolyte fluids to maintain a healthy balance of potassium, sodium, and chloride in the body. Blood sugar levels must always be monitored, diabetes medications must be taken, and insulin must always be administered in order to prevent diabetic ketoacidosis from occurring. The risk of diabetic ketoacidosis and other problems like heart disease, kidney damage, and stroke can be reduced by controlling blood sugar levels and avoiding infections. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.